Welcome again to the Medical Terminology Podcast. This episode is Chapter 10, Part 3, Pathologies of the Central Nervous System. Before we begin, do you remember what the parts of the central nervous system are? Well, that's the brain and the spinal cord. So as we look at the pathologies, I'm going to split them up into those that pertain primarily to the brain and those that pertain primarily to the spinal cord. So here we go. The most basic pathology we can talk about is one we're all familiar with, and that's the headache. And the medical term for headache is cephalalgia. Cephalalgia. And you'll notice the word parts are cephalo, which relates to the brain, and algia, which means pain. Cephalalgia is a medical term for a headache. And this is the common, ordinary headache that most of us get from time to time. Now, there's a second type of headache that we need to be careful to distinguish from the common headache. And that other type of headache is known as a migraine headache. Migraine, and then headache, Headache. And a migraine headache is different from a regular headache in significant ways. First of all, the migraine headache tends to be one-sided, whereas a regular headache can be more distributed across the head. The migraine headache usually is accompanied with some type of visual disturbance. Oftentimes people report seeing an aura or maybe vertical lines or something that is messing up their vision. People having a migraine often vomit, and they often have a sensitivity to light and sound. So these extra symptoms make it a much more severe experience than a common headache. So we want to be careful in distinguishing those two terms. Now, the next pathologies we have to talk about relate to injuries to the brain. And the first one I have is concussion. 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 Concussion refers to what happens when we have a violent shaking of the brain so that it actually hits the inside of a skull. Okay? It's the shaking action of the brain so that it hits the inside of the skull. And of course, this can happen in an accident. You fall, you hit your head, that sort of thing. Now, if one has a concussion, that can cause a further injury to the brain known as a contusion. 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 And the contusion is a bruising of the brain. It's important to keep concussion and contusion separate. A concussion is the shaking of the brain so that it can hit the inside of the skull. Now, that may or may not cause a contusion. If the shaking is severe enough in the concussion, you will have a contusion, which is the bruising of the brain. Now, if the brain gets injured enough, it could have something called a cranial hematoma. Cranial, cranial, which would mean pertaining to the skull because it has that al suffix. And then we have hematoma, hematoma. And do you remember what a hematoma is? Well, hematoma would mean literally a blood tumor, and usually refers to a collection of trapped blood somewhere. In this case, a cranial hematoma is a collection of blood that's trapped in the tissues of the brain. And there are a couple of subcategories to cranial hematoma. We could refer to a subdural hematoma, which would mean it is beneath the dura, subdura, beneath the dura, or more specifically, the dura mater. And the other type of cranial hematoma would be one that is above the dura mater. And using your knowledge of word parts, what would be the term for a hematoma that's above the dura mater? Well, the word part for above would be epi, E-P-I, and then pertaining to the dura mater would be dural. So it would be an epidural hematoma, E-P-I-D-U-R-A-L, and then hematoma, H-E-M-A-T-O-M-A. And then we get into some various diseases and disorders that primarily affect the central nervous system, the brain and or spinal cord. The first one you've probably heard of is tetanus, T-E-T-A-N-U-S. It can be referred to as lockjaw also, although tetanus is really the medical term. And this is an acute infection of the central nervous system that's caused by a toxin produced by the tetanus bacteria. Couple things to remember with infectious type diseases. Again, what's it caused by? Bacteria or virus? This is a bacteria, and like many bacterial infections, it's the toxin that's created by the bacteria that's what causes you trouble. This toxin attacks the central nervous system. The next one is Parkinson's disease, Parkinson''S. Parkinson's disease is a chronic degenerative disease of the central nervous system, and it causes these fine motor tremors, a shuffling gait. Often it's referred to as the old man shuffle, and it's caused by an inadequate amount of the neurotransmitter dopamine in the brain. And supplementing the brain with dopamine can often help alleviate some of the symptoms. The next one is cerebral palsy, C-E-R-E-B-R-A-L, and then palsy, P-A-L-S-Y. Cerebral palsy is characterized by poor muscle control, spasticity, and speech defects. And this, I hope you remember, is a birth injury. During birth, if damage occurs to the cerebrum, usually because of a lack of oxygen, then cerebral palsy is the result. And then the final one is Reye's syndrome, R-E-Y-E''S, then syndrome, S-Y-N-D-R-O-M-E. That's another one you may have heard about. Reye's syndrome is a serious, sometimes deadly disorder that's in children. It involves vomiting and confusion, and it is associated with aspirin treatment following a cold or a flu, that is some type of viral infection. And that's why these days they warn you not to give aspirin to children when they have a cold or flu. Okay, well, those are some basic diseases, disorders related to the brain. Now, there's another major category, and that is related to the stroke. And a stroke is when the brain becomes injured and parts of it, in fact, may die because of a lack of oxygen. The general medical term for a stroke is a cerebrovascular accident, C-E-R-E-B-R-O, cerebro, vascular, V-A-S-C-U-L-A-R. That's actually one word, cerebrovascular accident, A-C-C-I-D-E-N-T. That's the general term for a stroke. Now, there are two kinds of strokes. First of all, there's the ischemic stroke, I-S-C-H-E-M-I-C, and stroke. And if you remember from the study of the cardiovascular system, ischemia or ischemic means that an oxygen supply has been cut off. In an ischemic stroke, the brain is being affected by some type of blockage that is preventing oxygen from getting to the brain. This is different from what's known as a hemorrhagic stroke or a bleed. Hemorrhagic, Hemorrhagic stroke. A hemorrhagic stroke is when a blood vessel in the brain would break, explode, and blood would flow out of the vessel so that oxygen would not be carried to the brain. So ischemic stroke, there's a blockage, oxygenated blood can't get to the brain. Hemorrhagic stroke, there's actually bleeding in the brain so that the oxygen-enriched blood is not going where it's supposed to go. And one type of stroke event that may be a precursor to the ischemic stroke is called a transient ischemic attack. Transient, Transient, ischemic, Ischemic, and attack. A transient ischemic attack, or TIA, is like a very short-lived ischemic stroke. It's where there's just a momentary blockage, a brief interruption of blood flow to the brain. And the symptoms of a TIA, or transient ischemic attack, are stroke-like. They include blurred vision, dizziness, loss of balance, maybe interrupted speech. But fortunately, these symptoms are short-lived. They would pass within an hour. But they are a warning sign that a full-blown stroke, a full-blown ischemic stroke, could be on its way. And one symptom that's associated with strokes is called aphasia, APHASIA. And aphasia refers to the inability to comprehend speech. It's difficult to speak, read, write, or understand speech. And again, it's often caused by brain damage associated with the stroke. Okay, we've covered quite a few terms already, so I'd say now it's time for some practice. What is the term for a shaking of the brain so that it can hit the inside of the skull? That's a concussion. CONCUSSION. Now, if one has a concussion, one can have a bruising of the brain. What is the term for bruising of the brain? That's a contusion. CONTUSION. What is the term for a disorder that is characterized by poor muscle control, spasticity, speech defects, and is caused by a birth injury in which the cerebrum is damaged? Well, that's cerebral palsy, CEREBRAL, and then palsy, PALSY. Cerebral or cerebral, again, meaning relating to the cerebrum. What is the term for a chronic degenerative disease of the central nervous system that results in fine motor tremors or a shuffling gait? That's Parkinson's disease. PARKINSON''S. What is the medical term for a stroke? That's a cerebrovascular accident. CEREBROVASCULAR. Well, what is the term for the type of stroke that occurs when a blood vessel bursts or explodes so that there's bleeding in the brain? That's a hemorrhagic stroke. Hemorrhagic. What is the term for the symptom of a stroke that involves a loss of speech? That's aphasia. Aphasia. And what is the term for the type of stroke in which there is an interruption of blood supply to the brain? This can be caused by a blocked carotid artery or perhaps a thrombosis, a blood clot gets in an artery. Well, that's the ischemic stroke. Ischemic, and then stroke. And there's a condition that can be the precursor to an ischemic stroke. It's a short interruption of blood supply to the brain that can result in various stroke like symptoms, again, like numbness, dizziness, confusion, aphasia. And what is the term for this little mini ischemic event? Well, that's the transient ischemic attack. Transient, ischemic, Ischemic, and then attack, Attack. Well, what is the medical term for a headache? Well, that's cephalalgia, Cephalalgia. And how is a migraine headache different from a common headache or cephalalgia? Well, there's several more severe symptoms to look at. First of all, the pain is one-sided. There can be visual disturbances, vomiting, and a sensitivity to light and sound. What is the term for a collection of blood trapped in tissues of the brain? That's a cranial hematoma. cranial, and then hematoma, hematoma. Now, suppose one had a cranial hematoma that was beneath the dura mater of the brain. What would be the term for that type of hematoma? Well, that would be a subdural hematoma. Subdural, and then hematoma. What is the term for an acute affection of the central nervous system by bacteria? Well, that's tetanus. Tetanus. And finally, what is the name of a serious or deadly disorder in children that is associated with aspirin treatment following a cold or flu? Well, that's Reye's syndrome. Reye'Syndrome. Reye's syndrome. Well, that covers the brain. Now we have a few diseases and disorders that are associated more with the spinal cord. And the first one you've probably heard of, and that's meningitis. meningitis. Now, based on its word parts, what does meningitis mean? Well, that would be an inflammation of the meninges. And do you remember what the meninges are? Well, the meninges are a covering for the brain and the spinal cord. The next disorder is multiple sclerosis. multiple, sclerosis, clerosis. Multiple sclerosis is, first of all, an autoimmune disease, meaning the body is attacking itself. And this causes a demyelination of nerve fibers, meaning the myelin is being destroyed or attacked. And the loss of the insulation over the nerve fibers can cause problems with the conduction of neural impulses. And it can result in a loss of balance, fatigue, paralysis, and possibly speech disturbances. The next disease and disorder, fortunately, we don't have to worry too much about because we have vaccine for it, and that's poliomyelitis. poliomyelitis. And this is a viral infection that causes inflammation of the gray matter of the spinal cord. This is more commonly referred to as polio. And if you look at the word parts, it makes sense. Polio refers to what? It refers to gray. And myelitis would refer to what? Well, myelo is the spinal cord in this context. Itis is inflammation. So there we have inflammation of the spinal cord. With polio in front, it's the inflammation of the gray matter of the spinal cord. And then finally, we have a term that refers to the inflammation of the root of a spinal nerve that can cause pain and numbness radiating down an affected limb. And this term is radiculitis. radiculitis. And if you remember from the word parts section, radiculo refers to a nerve root. Itis would mean inflammation. So there you have radiculitis. And this is basically like a pinched nerve. You have a pinched nerve and it's going to cause pain and numbness radiating down the limb. And there are two subtypes based on where the nerve is, where it's being pinched. If we're referring to one in the neck, that would be cervical radiculitis. Again, cervical refers to the neck, cervical. Radiculitis, radiculitis. And then if it's in the lower back, lumbar, the lower curve of the spine, lumbar, and again it would be radiculitis, radiculitis. Okay, well that covers it for the spinal cord. So now let's do some more practice. What is the term for an autoimmune disease that causes the demyelination of the nerve fibers that can result in loss of balance, fatigue, paralysis, and speech disturbances? Well, that's the multiple sclerosis, multiple, sclerosis, sclerosis. And what is the term for the inflammation of the spinal cord? That's myelitis, myelitis. litis. And what is the term for the inflammation of the meninges? That's meningitis. meningitis. And what is the term for the inflammation of the root of a spinal nerve that can cause pain and numbness radiating down the affected limb? Well, that's radiculitis. radiculitis. And finally, what is the term for a viral infection that causes inflammation of the gray matter of the spinal cord? Well, that's poliomyelitis. poliomyelitis. Okay, well, that covers the major disorders of the central nervous system, the brain and spinal cord. And in the next episode, we will look at pathologies related to the peripheral nervous system. So this ends this episode of the Medical Terminology Podcast.